Is it normal for a scar to be ruched up? Good spelling of the word ruched. Is that how you spell ruched? How do you spell ruched? But that is a good spell. I don't know if that's how you spell it, but that looks good. I wouldn't have known how to spell ruched. Up following a tummy tuck. Yes. And I'll be honest with you, I probably don't make this clear enough to patients pre-op because, yes, it is. The way the tummy tuck is designed, we're always trying to limit the length of the scar, even though it's quite a long scar, always trying to make it as short as possible. And if you look at it, it's a big one at the top and there's one at the bottom. And if you look at it when you're doing the surgery, there's often a discrepancy of length in that there's more length at the top than the bottom. So if you just, for instance, started at the middle and worked outwards and just did it exactly as it is, you get massive dog ears, basically. Dog ears are bumps at the end of the scar. And so personally, what I do is I start on the outsides. I don't start in the middle. I start on the outsides to try and make sure there's not a dog ear. So I make sure there's not a dog ear at the ends, and then I work in. But as you start to work in, you're sort of robbing Peter to pay Paul on the outsides, but you've got to pay Paul at some point. So as you get to the middle, you've got to start paying Paul because you've robbed Peter, or you've robbed Paul. Anyway, you've robbed someone at the outsides, so you've got to start paying back as you get into the middle. And as you get to the middle, you have this big long big distance scar at the top, little distance on the bottom. And oh my lord, what I've got to, and you've got to start correcting it in. So what you do is you kind of pie crust it so it looks puckered, basically, or ruched, and you deliberately do that, or I deliberately do that in order to minimize the length of the scar. If you make the scar longer, you will balance out the discrepancy in length between the top scar and the bottom scar. The longer it is, the more that discrepancy gets less. If you make it like infinitely long, then that discrepancy is less. So shorter scar, bigger discrepancy, and more ruching or puckering of the scar. So it is normal to have a puckered scar. And personally, what I try and do is I try and make the dog ear as small as possible. And I'm okay with having it ruched because the ruche is the ruche, or the puckers settle. So the ruchedness settles. That's the big point, that the ruchedness does settle. So you're better off giving a shorter scar with ruching and trying to say to patients, don't worry about the ruching because it will settle, rather than a longer scar. And well, then you're left with a longer scar. So you rather have a short scar or a short-term ruche than a longer scar. So yes, the ruching is normal. Don't worry about the ruching or the puckering or whatever you want to call it. Pie crust, I don't know if that makes, like a Cornish pasty. It looks like it's not been stitched well, basically. Same with areola reduction, same principle, big circle to small circle. So it's all ruched up, all puckered up, and it looks like it's been stitched badly, but it's just because you've got a size discrepancy, so you have to kind of tailor tack it in, and it looks like that. But that is completely normal.